My name's Gary Edwards. I'm the Executive Director of the Salt Lake County Health Department.
And what does that entail, especially during the time of a pandemic?
Well, this is my first pandemic. As this has unfolded, this is much more than just a health department response. I am currently working out of the county's emergency management building instead of the health department administrative building, because we are very closely tied to the county's emergency management staff at this time. And typically in an outbreak, the health department, we just go about doing the management of that outbreak while at the same time continuing our regular public health activities. Many of our other public health activities have been scaled way down as we pulled staff to focus specifically on the coronavirus response.
The way things are structured currently, the county has to request approval for recommendations like the mask mandate or the color-coded system of risk from the governor's office. Can you talk about how that's worked out?
As we all know by now, back in April, the legislature met in special session and made it clear that for the coronavirus response, we were going to try and be as coordinated as possible as a state. And so the commission was established that makes recommendations to the governor. The governor agrees or disagrees. And if anybody then chooses or desires to have a recommendation or a requirement different than what the governor recommends, we have to get approval from the governor for that. For the most part, the governor has responded to the requests of Salt Lake County, but we've learned how to make it work, and we're getting done what we need to get done. And so, if I can go to the mask discussion first, since that is an example of a specific request that we made of the governor's office. The governor has indicated that he does not want a statewide order, but that he would allow jurisdictions to make that request based on their data. And so Salt Lake County did make that request. It was granted. On the 27th of June, our face covering requirement went into effect. Since the mask order has gone into effect, our percentage of cases has flattened and declined to where we are now 40 to 45% of the state's cases instead of 50% or greater. Much closer to our percentage of the overall state population. We are only one of 3 counties to have the mask requirement. We're really not doing a lot of things different other than that mask requirement. So we believe that that is an indication that what we're doing having an effect. We've looked also at hospitalization, and our numbers of hospitalization have plateaued while the state's numbers overall continue to increase. Now, certainly there are many other factors, and a factor related to that could be that we have perhaps more younger people contracting the illness than the rest of the state. I don't believe that's a large explanation to it, which then takes us back to what is the difference between Salt Lake County and the rest of the state. We have a face covering requirement.
Residents of Salt Lake County and specifically Salt Lake City, what can we do to further drop that curve here in the county and ultimately the state?
It's a great question, and we've talked about face coverings and how we believe that they are having an impact. But in addition to face coverings, that's one of our critical interventions. There's a couple of other things that we need to be focusing on. we still need to physical distance, even when we're wearing face coverings. Now, we say use a face covering, especially when you can't physical distance. But that doesn't mean when you can physical distance, forget about the face covering. When we're around groups that are not from our family household, we need to be remaining physically distant. Doesn't mean we can't carry on conversations, doesn't mean we can't be in the same room with people, but we need to remember to try and have that 6-foot separation. That increases the effectiveness of that face covering. In addition to that, we need to continue practicing good hygiene. We have to remember when we are ill, we stay home. We don't have to wait until we have a positive test confirming it. If we are ill, we need to stay home. And finally, if we are exposed to a positive case, we need to stay home because we may become ill and we may be spreading the virus 2 days prior to having any symptoms. And so we need to stay home through that incubation period of 14 days. Now, I understand that that's a challenge. It's inconvenient. We worry about our employment. Those are concerns. But if we want to continue progress, face covering, social distancing, hygiene, staying home when sick, staying home when exposed.